Welcome to The Explainer. When you hear the word schizophrenia, your mind probably jumps to things like hallucinations and delusions, right? But what if the most terrifying part of the illness isn't what you see, but what you feel happening to your own body? Today, we're diving into research that takes us way beyond the stereotypes and deep into the hidden, internal world of adolescent schizophrenia. All right, so here's our game plan. We're going to start with the behaviors you can see on the outside. Then we'll journey inward to what a patient actually experiences. And finally, we'll travel all the way back in time to explore where the risks for this condition might even begin. Look, let's be honest. Most of what we think we know about schizophrenia comes straight from the movies. But the truth is, the Hollywood version barely scratches the surface of this incredibly complex condition. So the real question is, what's going on underneath all that? To really get to the bottom of it, we have to look past the symptoms we think we know. And we're going to start on the outside with the behaviors that are so often misunderstood. Okay, so first up, we're tackling something that's, well, it's difficult to talk about, but it's crucial: the link between schizophrenia and aggression. Now, this can be an uncomfortable fact, but it's so important that we understand it. Study after study from Denmark to New Zealand shows a higher rate of criminal convictions among people with schizophrenia. Now, this is not about creating stigma. It's about looking at the data honestly to understand a very complex connection. But here's the key thing. This aggression isn't just random. Not at all. Research has actually pinpointed some specific predictors. The biggest one? The severity of positive symptoms. So things like delusions and hallucinations. But even before the illness really shows itself, a history of conduct disorder or escalating violence in childhood can be serious warning signs. Okay, so if treatment can help manage these symptoms, what's the holdup? Why isn't it that simple? Well, it all comes down to one of the biggest hurdles in all of psychiatric care: getting and keeping patients on their treatment plan.
And this is so important to get. For a patient, not taking medication often isn't a conscious choice. You have to remember, it's frequently a direct symptom of the illness itself. A patient might genuinely believe their medicine is poison because of a delusion, or they might lack the insight to even realize they're sick. It's a really tangled web of factors.
But there is absolutely hope here. And that's where incredible programs like STARE come into the picture. Instead of just focusing on medication, STARE is all about teaching real, practical life skills, things like problem solving and managing emotions, to help patients finally break that devastating cycle of hospitalization and incarceration. All right, we've talked about the outside. Now I want you to come with me as we go inside. What does it actually feel like to live with schizophrenia? This is where we find some of the most profound and frankly terrifying parts of the illness. Okay, this is where things get really fascinating and honestly a little mind-bending. The research draws this super important line between two ideas. People with schizophrenia usually have a perfectly intact anatomical body image. They know they have 2 arms, 2 legs, but it's their functional body image, that sense of how their body actually works and moves, that can get deeply, deeply twisted. Just listen to this quote from the research. It perfectly captures that feeling. Can you even imagine that? It's not just being scared of something happening. It's a deep, constant internal dread that you are physically losing control, that your own body is just grinding to a halt. And here's the thing, you might think, okay, that's a feeling, but it's more than that. This internal sense of breakdown actually shows up in a really specific and honestly startling way in psychological tests, like the famous Rorschach ink blot test. So when they're shown these ambiguous ink blots, patients with schizophrenia very often report seeing a mass of flesh. Think about that. It's like they see living things not as whole, organized beings, but as shapeless, disjointed masses. It's the perfect visual for that internal feeling of their own body breaking down. And get this isn't some rare one-off thing. In one study, a staggering 97 out of 98 patients saw this kind of imagery. 97 out of 98. That tells you this isn't just a coincidence. It's a core feature of how this illness warps perception. So we've gone from the outside in. We've seen the behavior, we've felt the internal experience. But that just leads to a bigger question. Where on earth does all this even start? To answer that, we have to rewind the clock way, way back. For decades, research was pretty much focused on 2 things: genetics and what happens after you're born. But as this quote points out, That was a huge blind spot. Scientists started realizing they were missing a massive piece of the puzzle, everything that happens in the womb.
So what this really shows us is that the risk isn't like flipping a switch. It's more like a slow cascade of events. Researchers now see it playing out across 3 distinct acts: the genetic hand you're dealt before conception, that once overlooked prenatal period, and then, of course, all the environmental factors after birth.
Okay, let's pull all these threads together. After all this, what have we really learned? Think about the journey we just took. We started with the complex link between aggression and the challenges of treatment. Then we dove deep into that terrifying inner world, that feeling of becoming an unmovable mass of flesh. And finally, we traveled all the way back to the very beginning, to risk factors that might be at play before someone is even born. It paints a picture that's so much deeper and more human than any stereotype could ever capture. And that leaves us right here with a really powerful question. Now that we know all of this, from the intimate inner experience of a patient to the earliest whispers of risk, how does that change things? How can this profound understanding push us toward more compassion, smarter treatments, and maybe, just maybe, one day prevention? That's the real takeaway. That's the challenge that this research leaves for all of us.